to teach us more about how we can, as pharmacists, we can integrate artificial intelligence with our work we do daily. Karibu sana.
Thank you very much. I think it's good afternoon. Yeah, my name is Anthony. It happens to be that my name is Anthony Irongo alafu ni AI. So I'll be speaking about artificial intelligence, and it's a very interesting topic. So okay, sir. Okay, so so this is artificial intelligence, and I know everybody, baka saizi, you've interacted with one of these digital platforms, and one of it mostly is ChatGPT. Sindio? So we're gonna see how we're gonna harness artificial intelligence to transform pharmacy practice. And today we'll be exploring the future of pharmacy by improving medication safety, supporting pharmaceutical professionals, and basically to embrace innovative technologies. And so with this, we'll have an overview. This slide is very dim to see, but basically what we are saying, we'll try to explore AI application across community pharmacy, hospital pharmacy, supply chain, and most of us have worked in supply chain, telepharmacy, which is an incoming thing that is being applied for patient safety and data analytics. Again, also we'll be able to address different challenges and also opportunities that we can leverage this artificial intelligence. So when we say about artificial intelligence, we have to define what artificial intelligence is, or AI. So by definition, we are trying to say, artificial intelligence is the use of machine that uses intelligence to propagate data and also produce what is called effective health processes and improving health processes. So by this we are saying that artificial intelligence is the ability of machines to simulate what human intelligence by learning different data, making decisions, and also improving healthcare processes. So we'll be able to highlight the evolution of artificial intelligence from the rule base, which was on the 60s, all the way to generative AI that is being used right now. And so we are able to demonstrate this by the growing impact. I don't know if you can see the figures basically. So why artificial intelligence is very basic to us as the pharmaceutical technologist, it's about this budget that you can see here. So this basically, it's an overview of the amount of money that the pharmaceutical sector is able to leverage using artificial intelligence. And so this is just some figures that we're able to see. And the key message here is that AI is not just replacing healthcare professionals, but empowering pharmaceutical technologists, also the pharmacists, to deliver safer and smarter and more personalized human patient care. So by this we are saying that basically the pharmaceutical sector has many challenges, and one of these challenges is about the workforce shortages, counterfeit medicine, fragmented healthcare information system, we'll see what that means, and the poor patient medication adherence. So all these will affect the quality and efficiency of healthcare delivery. So we are trying to say that there are these critical gaps that we face in the industry. So you'll see like the ratio between one pharmaceutical technologist or one pharmacist is about 16,000. So this is very huge. And so with that, we are able to see what the key areas that artificial intelligence can have. And one of it is about automation. We've all heard about what AI can do. So we are bringing in automation to automate our processes and our workflows. So by so doing, it's very minimal, but anyway. So by so doing, we are saying in terms of prescription basis, we are able to analyze if the prescription is written accordingly and what is being dispensed again also is according to what the prescriber has mentioned. So with that comes to automation. Then there is also decision support that most of these healthcare systems use. So if you're working in a hospital, definitely there's a system that is being used, and that system actually records data, and doctors use this platform to generate data, which again is being used to treat the patient. So by so doing, we are able to have support on this, and this is by basically trying to advocate on data integration between different systems. So for predictive analysis, we are all using at least a point of sale somewhere in our pharmacies, and so these systems are able to predict maybe what you're selling after what period of time and how many quantities you're selling of a particular product. So we are able also to integrate that. When you say machine learning, we are able to teach these AI models to learn our data. So if you're doing prescription in a hospital or there is a doctor who is prescribing, the agent is able to learn the processes of what you're doing. Then it will be able to automate that and then ease in the workflow. So more patient will be served, and then there is no a lot of energy that is wasted when it comes to delivering the patient care. So data analytics is very critical, and we can see the applications that we are using in community pharmacy. So I'll just take some time here because we've seen every other time in our social pages, there are these things called POSs that are being discussed, platforms that use artificial intelligence to describe what the products are. So smart inventory is one of the key things we as the pharmaceutical technologists that we can employ in our community practice. There is also expiry tracking. The model or the agents are able to automate the FIFO. So if you've done your dates accordingly, the system will generate you a list of what is expiring at what particular time. So it's very easy for you to analyze that data and see this product is expiring at this date. So don't worry, I'll share this presentation for you at the end of the presentation. There's also automated dispensing. We've not reached in this, but there are some hospitals that have tried to use automation in dispensing. And here mostly is the use of robots to dispense. A prescription is generated, then it's being served, but the patient now is able to receive this using a robot. So we've not reached here yet, but it's a process that is going on. Then we have AI-powered POSs. In our hospitals, data is very key. And one of the data that is very critical to the pharmacy is the inventory. So if you're not able to manage inventory accordingly, you will end up having losses. So by implementing AI or these agents, we are calling them agents because they are able to read the system and read the data that you're having, you'll be able to minimize the data loss, and also the cost of your inventory loss will be reduced. Then there is this part of medication reminders. We've seen smartwatches that are able to remind you that you're supposed to take this medication at this particular time, and also for adherence for these patients. Then there is also patient care. Again, also there are these smart systems that we can employ to at least assist the patients to get these drugs at the right time. So this is a very quick one. We don't have these machines here, but it's just an example of what we are anticipating to see maybe in the next 10 to 20 years about artificial intelligence, where we go to the hospital and you're able to see a machine dispensing. So we are not supposed to be scared about dispensing, but it's what the machine can do. So in hospital pharmacy, we have like oncology medication management. This is ongoing, and most of these facilities that run oncology medication, they are able to integrate AI agents in their systems so that we are able to read the prescription that the patient is given. So there are those molecules that are very critical and are very, very hazardous. So we are able to monitor that through AI. So clinical decision, I've already mentioned about that. So there is real-time prescribing alerts, prescription validation, we've seen some of this online platform asking us to send a prescription in their portal. So what happens in that, you're able to capture that prescription, then it's validated. By validation, I mean, if the medication is in your system, it be able to capture, and if there is a personnel who is there, will be able to capture that very fast, and it's being dispensed. So we've still seen what these other pharmacies that we've seen that are employing this. Then there is also medication error reduction in hospital. Pharmacovigilance also is very key. And by the year 2014 to 2021, PBB was able to receive 2,067 reports on pharmacovigilance. So right now, it's expected to rise because there is inclusion of artificial agents in our system. So it makes our work easier. We concentrate on patients, and these automated reports, they are being generated automatically and sent to Pharmacy and Poisons Board. So when you're talking about supply chain also, I know most of us are in this industry, and this is what we can see. The market size of supply chain is around $1.5 billion. So meaning that if we are able to maximize on this and not lose most of this medicine or the cash in it, we are able to at least leverage our businesses. And one of these things is about demand forecasting. So we are able to use AI or machine learning models or agents to analyze historical data. Things to do, like, I know KEMSA does that, meds at some point usually use that. So there are agents that read their data, and then they're able to see what their consumption is. And with that, they're able to at least have a prediction on what they can send or sell to their members. So again, there is also cold chain monitoring. We have special gadgets that can monitor special medication that require cold chain. So if there is any deviation on where that route or that medication is supposed to go, it gives a notification on that particular dose. So you've all seen that there are big trucks or trailers that have like a very specific chain or lock in their systems. So that is a digital tool that is used to monitor, and it's able to track that truck all the way from Mombasa, even if it's going to Uganda. So they're able to see that. So if there is any deviation, they'll be able to monitor that and maybe take actions on the same. Then there is also fraud detection. We were trying to think on how we can leverage on this, and mostly is to see some inconsistency on the pharmacy. So you're selling in a pharmacy, and as the owner, you're noticing some inconsistency in what you're doing or what you're practicing or selling. So you put detection in these agents. They're able to detect what those inconsistencies are. So for instance, you've employed someone and someone comes and auza vitu zake. So your stock is not going, it's not moving. So what happens is, you will notice from your dashboard that there is something that is not okay. So with that, it will give you a pop-up, and it's connected basically with WhatsApp or messaging. And then you're able to notice that something is not going okay with that. So basically, when you're talking about data analytics, is using dashboards to make decisions. And basically, we are trying to demonstrate of all the data that we have in a dashboard. So if you're using a system, you're able to see that you're able to monitor if there is any sales, there is any stock report or stock outs that is happening. You're able to monitor this. And this can only happen if you have a real-time agent that is able to monitor your stock inventory. Then this is very critical. We've seen that in Kenya, like 70% of our population lives in the rural areas. So we are trying to see how can we access these patients who are living in the rural areas. And one of these things that we are trying to use is telepharmacy. We've all seen that we can use telepharmacy in our practice. So telepharmacy basically is a communication between two people using video or audio. And one of the low-hanging fruits that we can use, it's WhatsApp. WhatsApp is very end-to-end encryption, and you are able to communicate maybe with a patient using that platform. So telepharmacy is very key for us. Maybe also on AI chatbots. We've also seen that one of the chatbots that is very critical, and I will urge you also to go and check it out. It's about the Shuru, which is KRA platform. It's an AI and it's on WhatsApp. So you can, right now you can just do your returns using just WhatsApp. So you don't need to go to the cyber, ask mtu wa cyber nifanyie returns. So use the WhatsApp, it's there. So just type Shuru, it will come, it will give you a number, and then you're able to do that. So we are trying to bring this also in pharmacy. So whereby you are able to order maybe medication and list all your products, then someone can interact with you. So we minimize that interaction of, hey, hello, uko na hii dawa. So we try to do that on the platforms so that you're able to access this. So when it comes to patient safety, basically, we are trying to see on drug interaction checks. So whereby is drug to drug, drug to food. So this is able to monitor that. And then by so doing, by 45%, we'll be able to reduce that. So any dispensing error that comes about with no critical consideration, then this will be taken care of. So there is also adherence tracking. You're able to monitor these patients' history on their products. The other is now, what are the opportunities that we have? So mostly, you'll see that these are the areas that you can employ AI. So when it comes to business growth, we can use these platforms to bridge our revenue. So we've seen all these platforms, and we can see some of the pharmacies that are within our disposal. An example that lately they did an advertisement in one of these radio stations. So they're using these platforms to generate revenue. So there is that opportunity that we can do that. There's also patient outcome, checking on the adherence, digital transformation, now employing those digital tools in our pharmacy setup, then which brings now that competitive advantage. So you're able to differentiate yourself from these other pharmacies. Ile pharmacy tu ya kawaida. So if you do ads, you've seen all in the TikTok and Instagram, people are just giving information using those platforms. So that's one of ways of using AI, because it's a machine learning model that attracts what you're giving, the information, and then it sends it to the people for awareness. So maybe if I mention the challenges that we're having, sorry. Okay, so sorry, on the challenges that we are having, basically is the infrastructure use of these tools. So you will see that most of the system that we are using, there is this challenge of infrastructure. So what are you using? So what is the amount of resources is required? What is the amount of resources that is required to run these platforms? Okay. Yes. So these are the challenges and the risks that for adoption of AI. One is data privacy, which is very critical. So this we have to link with the Data Privacy Act. Then there's a high implementation cost, which we also have to consider that. There's also regulatory actions that are supposed to be taken. Limited digital literacy. Most of us don't know, and that's why we are here. To learn about these platforms. So most of us, we've been privileged to have this education, and that's why we are doing this, because it's very important to have this. So we're not being left behind because of we don't know what is AI or what AI is being implemented to. So these are the regulatory considerations that we can have. PBB also has instructions on the same. Data Protection Act has also regulatory on the same, and also cybersecurity, which is very critical about AI. Then these are the future trends. So there is also assisted diagnostics, robotics in pharmacy. There's generative AI, which now is happening. You're able to, an agent is able to send email on your behalf with your tone, with everything that you're prompting it to do. So basically, as I finish, these are the case studies that and examples that have been done. So globally, there is Omnicell, which is a global company, American company, that is using artificial intelligence in dispensing. So it minimizes the cost of inventory by 43%. We have also Pharmabot, which is a South African-based company, is also using artificial intelligence. In Africa, we've seen Mpharma, also by supply chain, has been able to implement AI. Then there is also Zuri, which is being used for telepharmacy. Then there are some other like Dawasoft, which is a platform that can be used for community pharmacies to run inventory. So in Kenya also, for the government, they're using also to track ARV medication and also malaria. So these are basically what we can recommend for different stakeholders. For the government, we're asking them to at least to deploy policies that are able to guide this. Hospitals also, they can do training to their workmates or workforce to enable them at least have these skills. For the pharmacy owners, you can at least use these platforms that are at your disposal. And the cheapest one is basically WhatsApp. You can use that to automate your pharmacy. And lastly, maybe it's the healthcare workers. Well, let's do training, a lot of training. There is a lot of training online on these platforms. And with that, this is my conclusion. And we are saying the future of pharmacy is AI powered. So I'll share a QR code that you're able to scan. It will give you an overview of what the AI is and also the platform that you can use. And with that, I finish my presentation. We will interact in this QR code. It has so many information about this and even the presentation. And if you want any assistance in your community pharmacy to run these AI platforms, we're willing to support on that. Thank you very much and thank you for your time.
Thank you, Mr. Irungu. And I request that you come back. Kindly just come on the stage. Thank you. And colleagues, AI is here with us. You either adopt or expire. And it's our time in the pharmacy profession to adopt AI in all our operation. Now, Mr. Irungu is a pharmaceutical technologist and a member of KPA who has passion in tech. And now he has done a lot of tech, self-initiative learning, and he has his app. Let's just clap for the initiative that this young man has done, and let's support him. As KPA, we appreciate good work. And I'll request the secretary of KPA Nairobi branch to come and present a gift to Mr. Irungu.
Thank you so much, Calvin. Out of this presentation, I've come out with a number of terminologies. Robotics in pharmacy. Monitor dispensing error. Data analytics. Cold chain monitoring. Demand forecasting. Automated reports, pharmacovigilance, prescription validation, and clinical decisions. Mr. Irungu, are you saying AI is coming to eliminate our roles?
So basically, that's the question of every other industry that is being asked. But what we have to understand is there's those routine processes that will be taken over by these AI agents. But what that is very critical is the patient care that we still have and we maintain. So it will be able to take the normal processes that we do as we concentrate on our patients, because that's what is very critical. It's not able, it will give us suggestions, yes, but for you going through your inventory and looking for maybe what is going out of stock, that's very normal. So the system is able to do that and give you a report. But our main concern is that we need those skills so that if it comes to our presence, we are able to maneuver with it, using it. But we are not scared that we still maintain that mutual consideration with our patients.
Yeah. Thank you so much. So I'm slowly aging, and one of the challenges you said about AI is high cost of implementation, meaning the day it will get cheap, I may be very old. So I'm a bit safe.
Yeah.
So therefore, thank you so much. Tumpigie makofi tafadhali. We want to appreciate Mr. Irungu, and I will request one of us, all the way from Meru County. We have with us the chair, Upper Eastern. Please come and appreciate Mr. Irungu. Tumpige makofi tafadhali. Asante sana.
Thank you, Mr. Irungu, and we have to adopt to AI. Colleagues, next presenter on stage is Sun Pharma. And when you think of Sun Pharma, what comes into your mind? Sun Pharma, what